Afternoon, everyone, and welcome to our second session of Corona Conversations. We appreciate you joining us. Last week for our first session, we had about 55 attendees on the Zoom call. And if you are new to this today, if this is your first session, we want you to know we are videoing this for our speakers and our audience. If you miss it or want to tell someone about it, we will be providing that. I'm going to give some basic welcome remarks about the series, and Jessica is going to tell you some of the tech details that you need to know. So I'm going to ask Jessica to do that now, and then we'll continue.
All right, thank you, everyone. As Lacey said, this is being recorded, and any slide decks that are shared today will be sent to you tomorrow along with the recording, so you don't have to worry about that. If you have any questions, there is a Q&A button at the bottom of your screen. You can go ahead and type those in for us, and then at the end, we'll go ahead and address all the Q&A. We do have 30 minutes allotted for that, but if something comes up when one of our speakers is talking, please feel free to go ahead and type it in. So back to you, Lacey.
First, I want to make a comment that last week's session, we did begin with our parish president, our largest city's mayor, and Matt Faust representing our assessor. It was most informative and provided a lot of factual answers, replacing our recent most common but least favorite answer, I don't know. As explained last week, we are convening in an effort to have factual conversations, including facing some of the realities of the pandemic today and those that we will face next year and in coming years, and to put our heads together, because together we are stronger. On behalf of Susan Barnett and Chris Massengill with St. Tammany Corporation and North Shore Community Foundation, we remain fluid in our plans moving forward. We learned from our first session, especially on the tech front, and we've had 70 views of that recording so far. So all session recordings will be promoted for viewing to all citizens of St. Tammany. As you know, our now parish-wide chamber is in its first year of existence. BC, which we now may be calling before Corona, our board described 2020 as the first of 3 transition years to grow our membership, our support services, and our relationships across the parish, to build a stronger bridge. So last week, having Mayor Cromer speak to the attendees, who primarily, as well as today, live and work in Mandeville or Covington, enabled all of them to learn about many good things happening in Slidell, including Team Slidell, the unity in their community, business development, and stable or increasing sales taxes. So to many of us, that was a bonus of last week's session. These plans for these sessions began in late June, again among Susan, Chris, and I, and it has been fluid all along, and it remains somewhat fluid. So we are very optimistic that these conversations will be a tool in helping to educate not only our chamber members, but people across the parish. So we appreciate the participation of today's panelists in presenting facts as they are today, and any questions that still need answers. They include our major hospital CEOs, and will be presenting in alphabetical order. They will introduce themselves, and they will be followed by our parish coroner, Dr. Charles Preston. So we have a schedule and an agenda that we hope to stick to as closely as possible, but we are flexible. The plan is for our speakers to go until about 4 o'clock or 4:05 p.m. Then it will be followed by questions and answers that you can type into. So we'll begin again with Scott Boudreau from Avala Health Surgical Hospital, and he will be followed by our regional hospitals that cover all services across the parish. So Scott.
Thank you. Appreciate the opportunity and Chamber throwing this forum together. It's an important topic to go about in a parish. And the theme today was the good, the bad, and the ugly. And there's a couple of topics I want to talk about in regards to that. I'll start off with the good. I think what's happened with COVID-19 in the parish, everybody has come together to work to beat this disease and take care of patients as best need, because that's what their main focus is, on the quality of patients in healthcare. And while today's forum is basically to talk about healthcare, I do want to thank those companies that are not in healthcare that are coming together to work together with us to take care of everybody, whether it's the post office, UPS, FedEx, the banks, the insurance companies. Everybody's working together, and I think that's one of the good things that's happening in regards to this. It's important that we work together, because that's how you are successful. Even though we compete on certain levels, we all want to be together involved with this completion of the COVID-19. One of the other good things I think we found out is communication. It's important to let everybody know what's going on. With the LHA, they always send out daily reminders of how many beds are available, what supplies you need, and that communication has been going real strong. Everybody knows if they need something, they can call on us, or we can call on them, and it's working together. And it's not always communications that's the forefront of the issue, but this time it is, and everybody's working together. I appreciate that. Another good thing that we've found out is everybody's becoming mindful of our proper procedures, whether it's washing your hands or covering up your cough. Everybody's taking notice of that. I think when patients come into the hospital, they see that the professionals are covering up and taking care, that they know that's the way to do it. And I think it's spreading throughout the parish that everybody's taking this seriously. So that's a good thing that's come out of COVID-19. There's a couple of issues I wanted to talk about that aren't so good, and one is being one of the bad issues, I'd call it, is the future of healthcare workers. I think an issue that everybody's facing in the healthcare industry in St. Tammany Parish is that we're losing some folks to these traveling agencies or traveling nurses or traveling techs, people coming in and poaching our employees for higher wages. They can go out of state, they'll pay for their room and board and their travel and pay them a premium. And I think that's going to be an issue in the long run, because people are going to be leaving the state and the parish for that. Another issue is because of the stress put on by COVID-19, I think we're finding some people are retiring and getting out of the business and the industry. There's a lot of anxiety going on. I know nurses are really well skilled and resourceful, but sometimes the pressure gets so much that they're rethinking their careers, as well as some of the healthcare workers. So I think that's going to be a big issue for us in the future when this goes away, of where our healthcare workers are going to be coming from. Another issue I think that is on my bad list, if you want to call it that, is childcare. With the schools being closed, some of the daycare centers being closed, folks are having to stay home and take care of their children because they can't get family and friends to take care of them. And what's that causing is a bottleneck in regards to folks coming to work, other people having to work extra shifts, extra hours. So that's going to be a big issue if we can't get the schools open, as well as some of these child care centers going, because folks have to take care of their children, and sometimes they don't have any alternative methods. Another bad thing that I call it bad, but it could actually become good, is the visitation limits. As everybody knows, I think everybody's allowing one person to go to an inpatient room with somebody if they have a patient they're with. I fell actually into the trick last week. I had a friend of mine who was in the hospital. I said, I'm come visit you. Then I realized I couldn't go visit them because of the limits. So while it's bad, I think that actually could turn into a good thing down the road in regards to if you limit the number of patients, that limits the exposure people have to germs or infectious disease and things like that. So I think that could actually be a benefit from this. And I think some other folks will talk a little bit later on about that kind of thing that could change how we're doing healthcare and practicing in the parish. In regards to ugly, truthfully, it's the unknown. We don't know what's going on sometimes in regards to this disease, because we never knew about it. It just came up out of nowhere. And it's been a roller coaster ride. You get directives. I remember when it first came out, we were getting directives from CDC and LDH about every 2 hours, and you weren't sure what to do in regards to how to provide healthcare in regards to some of the avenues they were talking about. So I think the roller coaster and the unknown is still a big issue, and it's something that we just have to attack. But overall, I know we're going to beat this. I know everybody's working together. It's good to see everybody coming together. Hope everybody does well with this, and God bless. And Lacey, I'll turn it back over to you. Thank you.
So I do want to thank everybody for putting this together, between the Chamber, St. Tammany Parish Corp, and the North Shore Community Foundation. I appreciate you guys giving healthcare a platform to share our story and really talk about the impact of Corona. So when Lacey first called to talk about, the task, with good, the bad, the ugly, it's such a loaded task. And you're going to find that the topics throughout this presentation are going to range across the board, but I do want to share with you kind of the key categories or key things under each of these. So first and foremost, the good. There is no question that the entire community in our area embraced our hospitals. Really, you could feel the sense of support. I will tell you, when Pontchartrain Elementary came, it was incredibly heartwarming. There was something about kids coming to a hospital and sharing that kind of joy. But we've seen so many examples of that. Another one I want to share is actually, we had over 40 chamber businesses donate different items from food to PPE, or 40 businesses, and 20 of those were chamber members. And then also, we, in the very beginning of COVID, created a Zen room for our employees. It was really about giving them a place to get kind of mental time and space away from the stressors of COVID. And the North Shore Community Foundation sponsored that room for us. So there's a few pictures we wanted to share because they're no question, you can feel a lot of love through those things, and our teams at the hospital couldn't appreciate it more. So have to start with community as the first and foremost thing. The second is the innovation that really started in healthcare. All of the hospitals that actually took care of COVID patients, one of the key things was being able to protect your staff and still provide the highest quality care to the patients. Unlike many other conditions that we see in a hospital, this is one that obviously has a high spread rate, has a high risk to our employees. And proning is something that we do with patients. You turn them on their side every so many hours, and what that really does is it improves lung capacity. Normally, without any equipment, it takes 3 to 5 nurses or employees to turn one patient. Obviously, the larger the employee, the more, or the larger the patient, the more employees it may take. And one of our surgeons developed a device, which is actually in the process waiting on the patent to come through, but where 2 nurses can prone a patient and you don't need anything else. So this is the picture of the device he created, and them actually testing it. But it was, I tell you, something special that came out of COVID. Makes you incredibly proud that it was definitely a team effort. There was collaboration all across the board, but I wanted to share this as well. The other is the state of emergency that was established. So obviously there was a lot of support between the legislative offices all the way up to the president's office to declare a state of emergency. And in healthcare, it was, one, it was imperative, but 2, it allowed us to do some key things that we weren't allowed to do before. So without question, there was immediate mobilization of state and local public health resources that helped us. There's financial aid and support that comes through these programs. We also had the ability under this state of emergency to emergency credential nurses and staff that may have come from other states. The other is we had telemedicine expansion, which before wasn't there. And then we had PPE and remdesivir allocations come through this state of emergency. So the overall support that came as a result of the state of emergency, I would say was important and still continues to be important to healthcare providers in this day and age while we're still fighting the good fight. And lastly, when you talk about the good, I would be remiss if I didn't mention Lakeview Regional Medical Center is part of HCA Healthcare. We have about 186 hospitals across the country. And at the very beginning of the pandemic, the company took a very strong stance about protecting employees, keeping jobs. And there were several programs that were put into place from the very beginning. And the first was a pandemic pay program. So regardless of the hours that were worked for an employee, we were actually paying employees 70%, even if they were home not getting hours. The second one is a quarantine pay program. So if anybody gets sick with coronavirus, and regardless of their status, whether full-time, part-time, or PRN employees, they're actually paid 100% of their pay while they're at home recovering from the disease, also regardless of where they acquired COVID. And then we also have an employee assistance program called Hope Fund. This program makes me incredibly proud. The roots of this program actually go back to Hurricane Katrina, where HCA started a fund to support employees that were impacted by the storm. And now, company-wide, there's a significant, there's over 35,000 employees that have benefited from these funds. And during COVID, the company offered a 100% donation match. And it's reached a lot of families. It reached families in our own Lakeview family here, and it provided a lot of support. And then lastly, one of the things that you wouldn't think about on the day-to-day is for many of our employees, frontline staff that are exposed to COVID patients, taking care of them, there's a lot of fear and anxiety of taking the disease home, maybe to their families, their kids. And so HCA put together a program to keep our employees in hotels if they wanted to. And there's no question that has a tremendous local impact in our community. So just through June, since the coronavirus started, we've had over 430 local night stays at hotels that were paid for by HCA. So these programs make me incredibly proud to be part of this organization, that we can support our employees and ultimately our community by doing this. So let's talk about the bad. No different than this presentation right now. This has become our new way of life. And this screenshot was actually from this morning, our patient safety huddle that we do every day with all of the leaders across the hospital, where we review every patient and any potential safety concern. This is how we do it now. And I miss the interactions. I miss shaking hands. I miss giving hugs. But this is kind of the new way of life. So I put it in the kind of bad category. And extending beyond that, the emotional toll of COVID has been significant. These 4 pictures that you see here on the left are actually some of our volunteers. We had almost 100 volunteers at the hospital that had to stop volunteering because of the risk of coronavirus. Obviously, they're an elderly population. And they're the most vulnerable population. And you can see here what we do with them every week. We have a drive-through lunch. So we have some dialogue, interaction with them, but they come pick up their lunch, and we get to see our friendly faces. So just so you know, the seniors in our community are probably taking the hardest hit because they're not out and about, and they truly are sheltered in place, many of them to this day. The other thing is change. With the unknowns of the virus and the disease all across the world, there's a lot of guidance that's changing every day. Obviously, CDC is coming out with changes very regularly. So our nursing teams, all of our clinical teams have to be really resilient throughout it. That's one of our nurses there, Leslie, who's, I would tell you, a rock star when it comes to resiliency. And so I couldn't help but use her picture in this. But that's one of the challenges, or one of the bads, when it comes to coronavirus, is there's still a lot of uncertainty in all of the categories that you see there. So let's talk about the business of healthcare. It's fascinating when you think about, we have a global pandemic, which obviously directly impacts healthcare. Many healthcare organizations across the world actually bottomed out when it came to the normal book of business or patients. And I actually put 2 of our own graphs here so you guys can see the impact. The orange lines represent 2020, and you can see the prior year in blue. The left represents our admissions, and the right graph represents surgeries. And you can see we still are in the process of recovering from the financial impact and hit from COVID, and it's been a slow and steady rise back to what was our prior. But there's no question, obviously, the impact from the closures, from stopping elective surgeries, and the overall shutdown really, it had an impact on healthcare, and you can see it here. The other thing is, I think there was a general fear and anxiety of getting care at hospitals, or, you know, for yourself, if you're feeling ill, you know, you've got anxiety about even going to a hospital during the pandemic. And one of the things I will say is hospitals are the most prepared to take on something like this and a situation like this. We've got infection control practices to isolate and separate patients. That it's the safest environment you can be in, I would say, just because it's controlled other than your home. But you can see here that the impact of coronavirus has also had a significant influence on our own actual normal book of business. So let's talk about the ugly. This is our beautiful nurse, Brittany, who is far from ugly. But one of the things is obviously masking, right? That we're still fighting the basics of masking. I think if you ask any one of us here representing these hospitals, we tell you that masking is important, it's required, and it really does make a difference. And she put together this display of all the wrong ways people are wearing masks and the right way. But that's one of the ugly things, is that we're still fighting the very basics of prevention. The other is COVID's here to stay, right? At least for now, right? We don't have any short-term visibility on a true vaccine and the impact that will have, or a resolution to this. So you can see for the long haul, or at least this is our Region 9 in our areas, the numbers are continuing to be on the rise. For us in healthcare, there's no end to it. And so we're just, it's about resiliency and really being able to stay the course throughout this. And lastly, when I talk about the economic impact of coronavirus, for us at Lakeview, we are a large employer, and we're in the top 5, once you take all of our organizations into account, top 5 employer here in St. Tammany Parish. And so, you know, the viability of an organization like this is important to the overall community, just from an employer status. The other thing is rents and leases. We do over about $2 million a year in rents and leases. We provide a significant amount of indigent care to our community. Last year alone, we took care of just under 4,000 patients that were uninsured. And then lastly, we are a tax-paying organization, one of the very few in healthcare, and especially of this size in this community. And our local and state taxes last year alone were just over $3.5 million. And obviously, if our book of business takes the hit, ultimately the community does in the taxes that we pay. We are proud to be able to pay those taxes and do our part to support the community. It's something that HCA believes all across the board, but it really allows us to sustain in the long run as a strong and high-performing organization. So lastly, I will leave you guys with this. So I thank you all for your continued support, your trust, and for wearing a mask. And I had to use this meme because, I mean, everybody can relate. So thank you.
Thank you, Hero. All right, now we will call on Dr. Rydell, Medical Director from Ochsner's North Shore region.
Hi, first, thank you to the Chamber for organizing this event again, and I really appreciate everybody's engagement and involvement in this conversation. This is of paramount importance, as many of you know. From an economic perspective, healthcare takes on a very large portion of that conversation in this country and definitely in this community. I wanted to share a little bit with you guys on kind of this good, bad, and ugly theme that we have going on. So first and foremost, I think we should start with the ugly. COVID-19 is the ugly. We're dealing with an illness that we've never dealt with before, with a pandemic that most of us have never experienced or lived through in our generation, and have taken a pretty good uppercut from that. That can be shown in the challenge we've had to our businesses through the quarantine. That can be shown in the challenges all of our hospitals faced with incredibly high numbers of patients. The innovations that were required to handle those challenges. Many of our hospitals had to expand their ICU capacity, increase their staffing, find new ways to take care of patients, and have had to identify new treatment regimens, new testing protocols, all within the span of just a few short months. To put that in context, when I first started practicing, HIV was a new disease, and it took us 5 years before we had a test that could verify if someone had HIV. We now have a highly accurate test that we developed in the span of 3 months. So just kind of a little bit of context of that. Early on, I think testing was a key deficiency in this process, and I've seen a lot of people ask for questions, for information, kind of where testing is, and we've talked a lot about testing. In this community, we're now testing somewhere close to 1,000 patients a day. Those testing rates, the positive rates range anywhere from about 6 to 10%. They had actually got as low as close to 2 or 3%. I'm able to look at the data from just our local partner facilities, and data as early as today, we're around a 6% positive rate. Now, knowing that the number of positive cases is still very, very high, and still limited, and that is still significant. And that's where we get into some of the bad. And the bad is the inability to follow what are the very simple guidelines that help stop the spread of this disease. And it really comes down to 3 very simple things. Distance each other when we can, as much as possible, hopefully 6 feet, maybe more. To wash our hands frequently, which frankly is basic sanitation and basic good hygiene. And then to wear a mask when we're out in public and when we're around other people. And those 3 have been shown to dramatically reduce the spread and the course of this illness. So the more we could follow that, the better. Lastly, I wanted to spend some time on the good, because I think there's a lot more good moving forward than what we've seen in the bad. And I think following up my conversation, the partners that I work with at Slidell Memorial and St. Tammany will have a lot to say about the good of the work that their teams are doing and taking care of everyone within this community and the whole breadth of this community from the east side to the west side. But one of the things that I think is important is some of the advances that we've been able to see with this. Advances in testing. I was just looking at some of the testing data from the peak of this in April, which was around 150 tests per day for our group, for our organizations and our partner organizations, to well over 800 tests a day. Those tests originally were taking anywhere from 10 to 14 days to come back. They're now taking, in some cases in emergent situations, 15 to 20 minutes, and in routine situations, 48 to 72 hours. So a significant impact that's being done locally, being done by the facilities locally. Some of the national data does not support this, and we've been able to do a much better job with our community and with all the local support of those partners here. With that, there's been an opportunity to return to taking care of patients. One of the concerns early on was that patients delayed care, they avoided care. As a result, we've seen increased rates of heart disease and heart attacks, strokes, and other dangerous illnesses. Through the safety measures and safety protocols that we're taking, we're seeing a lot of people being able to return to their regular health care, and in turn help prevent unexpected cancers, help prevent unexpected cardiovascular events, all things that we saw as a concern. That's being done through a lot of enhanced measures. You're seeing those in your local businesses. Many of you have enacted those in your places of employment. And we're doing those here in our clinics in our hospitals, whether that's enhanced cleaning, increased screening like temperature screening and symptom screening stations, the ability to not congregate in lobbies, but to check in remotely or check in for your visits outside and then be able to come in, being called to come into your clinic. Ochsner, using Ochsner as an example, we did about 3,000 virtual visits in the entire year of 2019. In 2020, we were able to do 3,000 visits per day during the height of the outbreak, and we're still able to provide 15 to 20% of our visits are still able to be provided virtually for patients that are very high risk or even perhaps still anxious to come in. With all of that said, we're going to face a lot of continued challenges. The pandemic is not going to go away. The light at the end of the tunnel is a vaccine. The vaccine is being tested right in Louisiana. In fact, the first patients to receive phase 3 doses of that started last Thursday. So we're seeing patients already having that opportunity in the testing capacity. But for us to be able to administer those vaccines to very large numbers of patients could still be months or more away, depending on how well that vaccine works and how safe that vaccine is. There are new treatment opportunities that are being developed, but those continue to be tested and identified as safe and as effective. Until then, we're going to have to continue to find ways to live and work and be safe within this pandemic. One of the key components of that is going to be the ability to safely reopen schools and to work together with them and how they can do those kinds of things and safely reopen and continue to provide health care. One of the challenges that we are concerned about is as people come back to work, will they have work to come back to, continued opportunity to stay employed, to maintain their benefits with that employment, the ability to maintain their health insurance and things of that nature. But I think the way the community is rallied, the way the community has adopted these new measures and these new protocols, we've seen a stabilization of those cases. We've seen an improvement in the comfort and ability of patients to safely come into our clinics. And we think we're going to continue to have that ability to maintain that moving forward. So I'm really interested in the questions everybody's going to have as we get to the end of this, and excited about answering those, and really grateful that you invited me to be part of the panel.
All right. Thank you, Dr. Rydell. I like all the good news you have in there and all the realities that we all have to face. And we are trying to help people face them. So next up will be Joan Kaufman from St. Tammany Health System.
Thanks so much to you, to Chris, and to Susan for allowing us as healthcare leaders to have the opportunity to really share our story. And I guess, first of all, I want to thank all the healthcare heroes out there, and really want to give a big shout out to the healthcare leaders here at St. Tammany Health System, as well as those across the community that really have been at the forefront of the pandemic. Can't say enough about them. Also want to give a big shout out to fire, EMS, the community at large, and certainly to the foundation here at St. Tammany Health System for supporting our team in the extraordinary ways that have been done. So this first slide that I would like to share, Scott mentioned earlier the information that we're getting every day from the Louisiana Department of Health through the Louisiana Hospital Association. And I guess the takeaway on this slide is just simply to take a look on the right-hand side at the number of tests that have been reported across the state since the pandemic began. And actually today we're just shy of 1.5 million. And I think that's been something that's really helped to tell the story. When you have increased testing, of course, you're going to have more positive patients identified. And then what we're experiencing now is that level of community spread. If you take a look at the next slide is a depiction of our daily dashboard and some of the metrics we track every day. So you'll see for St. Tammany Parish, since the course began in early March, we've had 4,800 cases identified, 200 deaths. This is through the 4th of August. For St. Tammany Health System, and this really is about the good, the bad, and the ugly of the COVID journey here at St. Tammany Health System. Today we have 29 positive inpatients here at St. Tammany, of which 2 are on a ventilator. And we have had 55 of the 206 attributed deaths here at St. Tammany. We also have discharged 235 patients, one of which, I have to tell you the story, is a 96-year-old lady who was discharged after being treated for COVID. She was on a ventilator, and she was so happy to be home that on her follow-up discharge call, wanted us to know she's happy, she's healthy, and she was eating a bologna sandwich. One of the things we are most interested in is we have had significant recovery and restoration of our historical volumes. So today, for example, our inpatient census is at 167. For our emergency department, we've seen about 108 patients and on average around 100 patients per day. Just for context, pre-COVID, we were at about 133 patients per day. And what I think is important about tracking that data is that we think that perhaps our new norm may be in the 100 patient per day range, because what we're seeing is a higher level of acuity in our emergency department and far less low acuity patients being seen there. We also have introduced video visits, as Dr. Rydell mentioned. And we last year and all of 2019 only had 19 patients on video visits, and this year have seen over 6,000 visits via video. We're now back in more of a plateau and probably an average every day of about 13 visits per day. If you'll go to the next slide. When you take a look at the journey since we saw our first patient back in early March through the end of July, you can see the peak for us occurred in mid-April. In that light pink, we had a lot of patients who were patients under investigation. So we were waiting for test results to come back to us. Now that we have more readily available testing, those results turn around far quicker. So the pendings have really nearly gone away. We also have seen a significant decline in the number of patients who are placed on a ventilator, which for us was a real win, and I think you've heard that across the nation. And then you can see, as you look at our positive inpatients, the height in early April or mid-April kind of plateaued down, and we just have seen a little bit of a spike of late, probably the last 2 to 3 weeks or so. We've been averaging at around that 20 patient mark for inpatient COVID positive patients. The next slide you can see really does a nice job of, I know it's probably hard to read, but you'll get the decks afterwards, but a really nice job of defining what the characteristics of our COVID positive patients are inpatient-wise and those that have passed. What I think is interesting about this slide is that when we first started tracking the data from an epidemiology perspective, our patients' median age was 60 years old. It's now down to 54 years old. And I think what's important about that is that we are seeing the transition of the virus to a younger population, a lower level of acuity. In terms of demographics as well, I would just point out that most of our patients are coming in with comorbidities of diabetes, hypertension, obesity, and sleep apnea. 75% of the deaths that we saw were greater than age 75. And in terms of our post-acute population, those patients who are coming to us from nursing homes, right now we have about 5 patients in-house. We had about 16 at the height and as low as 2. If you look at the next slide, it shares a little bit about what we're doing in terms of treatment. And what I would say is that we've identified hydroxychloroquine not to be an effective course of treatment for our patients. We rarely use it here at St. Tammany, and the side effects are super risky. What we are seeing very much used and far more effective is the use of remdesivir, convalescent plasma, and dexamethasone, which is a steroid. In the next slide, what we'd also learned early on, probably day 6 in the pandemic, was the opportunity to really combat COVID outside of the hospital. So we started a drive-through testing site at our Mandeville Diagnostic Center Monday through Friday, and allowed patients to come through with a physician order and get tested. What we have found with our restoration of volumes, more to a new normal or routine day, is that our routine patients who are fasting and coming in for testing were getting backed up in that site. And quite honestly, the police were called out once or twice because the line for the testing was so long with patients waiting. So we've looked at an alternative site and started this a couple weeks ago on Highway 22. It's our former home health and hospice location. And patients can come in there Monday through Friday from 8 to 3 with a physician order for testing. In the next slide, you can see how our testing has played out in the various places that we have been able to send our testing for resulting. We've tested over 10,000, actually close to 11,000 patients for COVID since this began in early March. So quite a bit of testing going on. In the next slide, you can see both in terms of rapid testing and routine testing where we're providing that to our patients. So for example, we're using the more rapid testing, the Abbott ID and the Cepheid testing, 15 minutes or 45-minute test results through our emergency department, on our inpatient units, and then in our new family center, as well as our infusion center, because we need those results timely so that we can make decisions far more quickly. The more routine testing, those tests that take a little bit longer, up to 48 hours to come back to us, are done for our outpatient areas, any pre-admission testing for surgery, pre-op testing. Our drive-by now walk-in site on Highway 22, we send out to a number of places, 2 of which are named here. As you look at the next slide, I think what's so important and something we learned early on, you know, everybody was really isolating our patients that were COVID positive. And what we realized is that we don't want patients to suffer in silence, or certainly not die alone. So we really have been very thoughtful with our visitor policy, and just this week have opened it back up, even though we have an inpatient census of about 20 on average right now, to allow 1 caregiver per patient per day. Clearly, they have to pay very close adherence to our visitation and masking policy so that they can keep themselves and others safe throughout the stay. We do have fluctuations to our visitation policy as it relates to those at end of life. We want to truly accommodate the family at those most vulnerable times. On the next slide, you can see personal protective equipment was clearly something you heard a lot about. We were on a just-in-time inventory system, so we kind of got flipped on our head when our demand was greater than the supply that we had. But we are so fortunate, and I again want to applaud the community for this, because we clearly never ran out, and we're able to keep our colleagues and our patients in the community safe. What we have done is to create a goal of 90 days surplus from the height of the pandemic for each of the supplies that are required to support patient care. And I think that that is going to serve us well as we see these spikes in volumes as we move forward. And the next slide, you can see what we have in terms of our surge plan. You know, we just don't know when we're going to see a heightened census, but we do have a plan in place. It was in place when the pandemic came on to us, and we are certainly prepared to surge as needed and as volume dictates. In terms of innovation, you know, I really applaud our team for the great innovations that we have experienced throughout the pandemic. There are many, many to name, but I guess I'll just comment on a couple. We are underway right now with a double-blind IVIG study for antibodies, and that is so important to us because it allows us to understand over time what the impact of the virus is going to be. And then in terms of convalescent plasma, this is something that we are participating in with Mayo Health System to better understand how plasma is going to impact patients who are being treated for COVID. In terms of the Get Well loop, this is something that we initiated early on for our patients who are discharged home. And we actually have 3,323 patients enrolled today. It keeps us in the loop with patient care as they leave the hospital so that we can track. We discharge all of our patients with a pulse oximeter as well as a thermometer so we can track their key metrics and make sure that they are safe outside of the organization. And then the Safe to Return program that Ochsner initiated early on really has been an outstanding program for area schools and businesses across the Ochsner footprint. St. Tammany's role is just to have that local presence and contribution to help support the great program that Ochsner has placed in our community. And then on this last side, when we talk about challenges, clearly point of care testing is a big challenge for everyone. We are trying to make sure that we always have enough testing to be able to care for our patients in our community. And so far, we've been very successful in that. In terms of community education, here's my plea, much like Hero, 40% of the patients that we know are COVID positive are asymptomatic. So slow the pace, cover your face, please wear a mask, wash your hands, practice social distancing, and be socially responsible. What we also know is that delayed care is a big concern of ours. We know that Becker's reported for the state of Louisiana, 36% of the population is postponing care. For those patients who are suffering from chronic conditions in the home, that's a concern for all of us. So we encourage everyone to continue to reach out to your healthcare provider and continue to receive that level of care so you don't end up in an adverse condition. We have had a significant economic toll taken on the organization. What I would say there is throughout the pandemic, our colleagues were first and foremost. We kept them whole the entire time throughout the pandemic. We did not have any furloughs. We have received federal funding and also Parish CARES Act funding, for which we are very, very grateful. So we really feel like in light of the pandemic, we are coming out very much positioned to continue to take on the responsibility that we are so proud to carry in terms of caring for the parish residents. I would also say that it's going to take every single one of us together to balance the public health and the economic prosperity as we move forward. We are moving forward with our bed tower expansion. Very excited to have our first patient seen there on December the 1st. So I'll pause there, and thanks again for the opportunity to tell our story.
Thank you, Joan. Very thorough report. I know I learned a lot and took a lot of notes. So just to let everybody know, we are running a little behind, but we should still be able to be done by 4:30. But if not, we can keep going, and if you need to sign off. Next up is Sandy Badinger, CEO of Slidell Memorial Hospital. Sandy?
Hello. Can you see my screen, Lacey?
Yes.
Okay, great.
Yes.
Hi, everyone. I want to thank Lacey and the Chamber, as well as Chris and Susan from the North Shore Foundation and the St. Tammany Parish Corp for allowing us the opportunity today. Much like you've heard from the majority of the other CEOs, a lot of the same content. First and foremost, I'd like to thank everyone. I'm going to give an update on the Slidell division, so that will include Slidell Memorial Hospital as well as the Ochsner North Shore campus. First and foremost, I think the good, the bad, the ugly. I think the good, starting with what every single person has already commented, the teamwork. Just want to share a couple of pictures here. Want to thank every single person who has stepped up, every leader in the parish, the fire department, the police department, every single person who helped out our team during the peak of the crisis. All the food that was donated from the community. The community really helped, sent a lot of cards and notes that were very uplifting to the team. And want to thank the Slidell Division leaders here at the hospital as well, because we could not have done what we were able to do without them. Just a quick update on the total tests combined. Again, this is going to be for Slidell Memorial Hospital and Ocean North Shore. As of yesterday, we tested a total of about 11,687 patients. You heard Dr. Vidal talk about between a 6 and 10% positive rate. We actually have a 10%. About 1,197 of those tested positive, of which 40% of those were actually hospitalized. We had about 90% or 10,490 negative rate. Wanted to share, similar to what Joan shared, back in February, I guess, February, March, when this started, the blue line represents the SMH census by day and by time, and the orange represents Ocean and North Shore. So very much like Joan reported out, it looks like March, April was our peak. That was inpatient, hospitalized census. The majority of those patients at the time were on vents. As the peak came down, you see the little spike back up in July at both campuses. So we're not nearly where we were, but definitely a spike back up. I want to talk a little bit about where we are as of this morning. So combined, and this is not total beds, this is just med-surg and ICU beds. We also have NICU deliveries, labor and delivery beds. But for med-surg and ICU, which is where the majority of the COVID patients come in, we actually have 261 available beds in Slidell. Right now, today, we have 173 of those beds occupied. So we were at about a 66% occupancy rate. 29 of those patients are COVID. And if you look at the breakdown, med-surg, we have 16 combined in the med-surg unit, and we have 13 of those in our ICU. I also broke out at the bottom the vents to show that we have a total of 47 vents in the division. We have 9 patients today on vents as of 7:30 this morning. 4 of those are COVID patients. So of the 13 in ICU, 4 of those are on vents. So I wanted to share, we have plenty capacity in the division. And also wanted to break down of the hospitalized patients that we saw earlier, the 40% of the positive, wanted to break it down. A lot of people are showing the demographics, and wanted to share with you in the Slidell division what we're seeing. So of those hospitalized patients, we are seeing 61% of those patients that were hospitalized by race are white, 35% Black or African American, and 2% Asian, and 2% other. The age of the patient on the right-hand side of the graph shows the biggest population is 45% of those hospitalized are between 61 and 80 years old, 27% between 41 and 60. So just to give you a little breakdown. We did see 10% between 18 and 40 years of age. And on the next slide, just wanted to share, again, going back to the COVID census, right around June 17th, we actually had, for the first time, 0 patients in the house. So we looked at the overall length of stay prior to June 17th. That's kind of why we picked that date. We actually saw those patients staying with COVID about an 8.8 day length of stay. So patients staying little over almost 9 days. And now what we're seeing after June 17th, a much lower length of stay. These patients are not, as Joan showed on her chart, not not many vented patients. So we only have 4 of the 29 in-house on vents. So those are going to the med surg units, and they stay in about 5 days in the hospital. And, you know, last but not least, just wanted to, like everyone, encourage everyone out there to please wear your mask, and keep everyone safe. So thank you very much.
Great job. Thank you, Sandy. I like some of those numbers too. Dr. Preston, you've got the last word before Q&A. We already have one question for you, but let's see how you can inform us in the next 10 or 12 minutes.
And and so I hope to, as the cleanup batter, make up some of the time and get us on track here. I anticipated that most of the hospital leaders would give the important data as they did, and I really appreciate that. In the President's Advisory Council, I'm known as Dr. Buzzkill because I'm the one who keeps sort of bringing the bad news that, you know, we have to recognize for all of the gains we're making that coronavirus is still just as contagious and just as potentially deadly as it's always been. And so we have to really keep our guards up. I think that under the good, since the mask mandate on a state level came out, I am certainly seeing much more compliance with mask mandates. And just as Dr. Rydell said, this is really simple stuff. Wash your hands, cover your cough, social distance, and wear the mask. And the more people that comply with that, the less likely we are to overwhelm the healthcare systems. As both the hospital CEOs mentioned, I think treatment is really improving in terms of we're finding out what doesn't work, that in 2 big studies now, hydroxychloroquine has been shown not only not to be useful, but to be harmful and associated with a higher mortality rate, where remdesivir and convalescent plasma has great promise. Bridges to avoid intubation like BiPAP or high oxygen flows, that if you can keep somebody off the vent, that their mortality tends to go down. And I think this is kind of a good thing that our death rate in St. Tammany Parish has really been pretty flat. It has been between 0 and 3 people a day, and it averages 0 to 1 or 2. As we're seeing in the population of hospitalized people, we are seeing a shift to slightly younger people and folks that are acquiring it in the community more than in congregate living centers. And again, I think that that's a good thing, that it's still remaining with a relatively flat death rate. In terms of the number of cases in St. Tammany Parish, we follow very closely the 14 and 21 day time periods, because those are the gating periods from the president and the governor. And the good news is they are on the downslope in St. Tammany Parish. The bad news is we're not judged as a single parish, we're judged as a state. And so it really matters what the state numbers are. But I think that that's a good surrogate indicator that we are making some headway in controlling the spread of this horrible virus. I think in the bad department, at least looking at Region 9, the percent positives are going up, and a percent positive, of course, is independent of the number of tests that are being done. On July 7th, it was about 6.13%, and as of yesterday, it is 7.04%. Still below the 10% panic level, if you will, but it's a concern that it continues to climb despite our best efforts to get this public health message out. And then I think the ugly is yet to come. I think that as we begin to congregate more, the opening of schools. I think it's pretty well established that children are spreaders, if not super spreaders, that we may see an increase in cases there. And if we're ever able to slide out of phase 2 into phase 3, the more people get together and the more that corona fatigue takes over and people say, I'm just sick and tired of being sick and tired, and I'm not going to wear this mask and I'm not going to wash my hands, then we're going to see more and more numbers go up. So like everybody else, I think the ultimate light at the end of the tunnel is going to be the development of a vaccine. It is happening at light speed, and I think that's very, very, very encouraging. But they're unfortunately, this is not what Lacey wants to hear, but there's a lot more that we don't know about the behavior of coronavirus than we do know. But we're learning more every day, and I think that we're doing what we need to do in order to try and stop the spread. And ultimately, it's absolutely right. Slow the pace by covering your face. And every time that we can possibly reinforce that message, it's important to do that. And that's all I have for you.
All righty. Thank you, Dr. Preston. As long as we don't know, we're going to keep looking for the answers, and we're going to rely on you guys. All righty. So I am going to go right into some of the questions. We don't have too many, and some of the answers, I believe, have already been discussed. All right. I'm going to start. These 2 questions are actually for you, Dr. Preston. Today, I ask again if we can get data daily from our 4 major hospitals sent to our parish, EOC, and Dr. Preston. This would allow us to chart and have more accurate data specific to St. Tammany Parish. Region 9 does not represent what is going on just in St. Tammany. Actually, Dr. Preston, I don't know if you're the one to answer that or not, but want to take a stab?
Well, I mean, I would certainly be willing to do that. We track a number of data that originates in our office and originates out of the state. We don't get reports every day from the hospitals. I think that, of course, that's really more appropriate for the hospital CEOs to say what data they're comfortable with sharing. And of course, that's creating a workflow for somebody else that I'm not in charge of.
Right. Do any of the CEOs want to take a stab or confirm or affirm what Dr. Preston said about the workload? Because I heard a lot about a lot of workload.
Lacey, this is Joan. I think we report data daily to the state, and I think it really is going to come back to who at the parish level has the time to be able to compile the data to publish it. So right. I think there would be willingness to push certain key metrics out, but somebody at the parish would probably have to organize it all.
Right. Thank you, Joan. Here's another question that I think I know the answer to, but are our 4 large hospitals communicating at least weekly, sharing best practices to ensure the most efficient medical care for our citizens?
I'll take that one, Lacey.
Okay.
This was at the beginning of COVID and really throughout the peak. We did have weekly calls, and I actually applaud the North Oaks leadership who put it together and connected us all together. Michelle Sutton did that. And so we were doing calls every Friday, and then we eventually got to the point where we didn't have probably new information sharing or anything like that happening, but we still communicate pretty regularly. I think all of us have each other's contact, text. So there's no question that this is a collaborative effort between all of us to take care of this community and fight the virus. So yes, there is regular communication.
Okay, thank you.
And Lacey, I can add to that too. Our clinical system extends throughout the entire state, even into Mississippi. And so our hospital care team is able to meet on a weekly basis and share both the research data that we've collected through all of those sites that is connected also to the National Research Data Bank, and is able to share it with the hospital teams and the ICU teams across all of our facilities and hospitals. We've also been able to publish a lot of that data, and that data is able to be used by all of the local health systems as well. So all of that is sort of in the same data bank that's being used by everyone to make decisions and to continue to improve. And I think that's, to Dr. Preston's point, one of the reasons we've been able to see an improvement or a stabilization in the death rate, but also the reason we've been able to see a reduction in the ventilator rates and things of that nature is related to very quick, very difficult learnings from this disease in a very short period of time.
All righty. Well, we have one more kind of detailed question about statistics, and it's kind of implying that the media is having a hard time reporting the statistics as well, but I'll read the question, so you've been warned. I've noticed that the media all report statistics about the cumulative numbers, which gives a good idea of the size of the epidemic, but that information doesn't help the public understand whether things are getting better or worse on a week-to-week basis. It would be better if they reported percentage of increases or decreases, along with trends in positivity rates and rates of transmission. It would be great if you could help educate the media so they could do yeah, that's what I thought. If they could do a better job of informing the public what is happening. Thanks for all you do. And I think I did share a graph with Dr. Preston about that, and it looked easy to read, but I don't know how they go for it, Dr. Preston.
So yeah, I do remember you sharing a dashboard graph that put all that together. I was sort of chuckling because I would love to educate the media and be the one person who is in control of what they publish. That's a very double-edged sword. We were getting calls early on that people wanted to know the specific address of people who died from coronavirus because they wanted to know if coronavirus was on their street or not. And that kind of granular information is not really useful, and it can both, create panic and then create the false sense of security that, well, I live on Oak Street and they died on Elm Street. So in terms of the trends of the pandemic, I think cumulative data is important. I do share with the parish president and mayors and other leaders data specific to St. Tammany Parish, and we look at the total cases, the death rate, the slope of increases, decreases, etc. So it would be very difficult to put that on Facebook every day, and I'm not sure that that's really useful for the average citizen. I think the important thing is to know that this pandemic is still very, very, very serious, and it's going to take a continued concerted effort from every single citizen to solve this problem. Government is not going to solve the problem. It's going to have to be solved on an individual citizen by social responsibility basis, in my opinion.
Well, your opinion is certainly valued. Couple of questions about the treatment itself, and another question about children. What data do you have to suggest that children are super spreaders? I did not see any indication of this in numbers shared today, but I think this is critical information to understand as we get closer to going back to school. I personally have not heard anything about that.
Well, I have to give you my standard resource, which is CBS Evening News, because that's the only national news that I watch. And over the last couple of days, they have cited studies that children are are at least over 10 years old are spreaders, and that they may in fact be super spreaders because they're asymptomatic. And of course, you know, that's the big difficulty that educators have, is how are you going to keep these children apart from each other, washing their hands and keeping their masks on?
Lacey, I can comment on that as well. We are working very closely with the schools, and as Joan mentioned, has created a Safe to Return program, both for employers and for schools. And I would second what Dr. Preston said. We are actually finding that very, very young children, those preschool and lower grade children, are not super spreaders. In fact, it seems as though their heightened immune systems help protect that. But as those kids move into their preteen and teenage years, their ability to spread increases. And so continuing to work with our older children about wearing masks and, you know, doing all of the criteria that we've mentioned before are extremely important. There's a significant amount of data of the harm that is happening to children as they don't attend school. So it's a bit of a delicate edge there between the dangers of not going to school and the risks of the illness. That risk seems to be more in children spreading it to adults. And so how those adults continue to protect themselves and those children is very important. So very clear guidelines and very clear plans for how children return to school is going to be an important piece of how we can be successful moving forward.
Anyone else have comment on that children issue? All right. So now I'm going to go to a question that I have discussed with one or two of you about treatment. And let me read two questions. How can you say hydroxy is not working when you have so many doctors using it early, including Yale professor? Are any of you using hydroxychloroquine? And if so, is it working? Or is it being used early in the course of the virus before they are hospitalized? So I guess that's a hot topic. And Dr. Idell, I see you shaking your head. Or
So I would say from a medical perspective, this is not a hot topic. The data is overwhelming against it up to this point. There's actually continued research going on because of what a hot topic it has become. So there is continued research still going on, but that research has continued to show that there is not an appropriate place for that use. Hydroxychloroquine, especially when combined with azithromycin, can cause fatal heart arrhythmias in certain patients. And as a result, the risk of using it on an aggressive basis creates a dangerous combination because of that. Hydroxychloroquine does have many safe uses when used in proper context by proper people. So it is a medication that has been used for other things in the past. And frankly, because this is a new disease, there is a lot of research going on with medications that may not previously have been thought of as used for this medication. So one example is there's research going on using new hepatitis drugs for the treatment of COVID. But like many things, you know, you can go based upon a very anecdotal evidence. You know, my uncle took it and they got better. Or you can go with research studies that look at thousands of people, identify what works compared to simply just a placebo, and what works with that safety profile as well. And so I think that's an important way for us to approach this, and very hard way to approach this in light of it being such a dangerous and difficult disease for us to address.
thank you. I think this would be the final question, which is good because it's going on about 4:20. And if anyone else has any other questions that did not get answered today, if you want to email it to Joan or Jessica or me, if you have my email, we'll be happy to send it on if it's for a particular one of our panelists today. Are you all getting what you need? Support, information from LDH. The general public is very untrusting of the numbers reported on their site. Do you agree with those numbers? Here,
I'll take it. So I think more than focusing on the daily numbers, the more important thing are trends, right? When you're looking at data, that really is what tells the story on whether we're improving or we're not. You have to remember, you know, the data is coming so fast, and they're set up in new systems. We weren't prepared for this to happen overnight, and we're getting better. But the public health data, I think, if you ask me, is probably as accurate as it's going to get for the speed at which we developed it. But the more important thing is to focus on the trends. That's my 2 cents on that one.
thank you. Well, thank you all again for participating. Our plan was and is at the end of each session to have some closing remarks from the Chamber, the Foundation, and St. Tammany Corp. So I know that Susan Bonnet is on the line, and if Susan would like to make any comments about our series or this particular session, can we ask you to do that, Susan? Is she up? Okay.
Yep. Can you hear me?
Yes.
Great. Yeah, I mean, first, Lacey and your team at the Chamber, thanks for doing all the back end of this. Y'all have been tremendous. But, you know, I have to say on a very positive note, even though, you know, sort of the subject matter was the good, the bad, and the ugly, the good community-wide as it relates to this is to hear our hospitals and our medical community not just give us good information and good data, but the extent of collaboration and the extent of communication and the extent of openness and accessibility to the information, I think is very unique to our community, certainly if you read national news and believe any of it. So to our hospital partners on the call, you know, we really are grateful as a community for what you guys do, not just in the practical application, obviously, of the importance of what you do and your missions, but clearly from a how you do it in our community perspective. Y'all all go beyond just being good corporate citizens. You're good partners for all of us. And I think I speak for all 3 of our organizations, Chris's, Lacey's, and ours, certainly when I say that. So thank you all for not only doing the day-to-day healthcare and keeping us alive and well, but truly for doing your part well above and beyond in just being great partners. And we're grateful for y'all doing this today, and we're grateful for y'all continuing to keep us informed on what we need to know and, more importantly, what we need to do. So thanks to you all.
Before we formally started today, I brought up that the parish, the corporation, and the Chamber have partnered to come up with some signage to place inside businesses or on your cars. It's not too much to ask, please wear a mask campaign. So we have these bumper stickers, and we have big, not too big, but big enough to make an impact signs that are like clings for your doors to your businesses. And they can be picked up at St. Tammany Corp, at Coop Drive, or either one of our Chamber offices. So we hope that what we have heard from the beginning is social responsibility. We cannot mandate it. All we can do is continue to preach it and spread the message in any way that we can. It's beginning to get a little personal even for some people. I think what all of you said, this is new. We didn't know it was coming. We didn't know what to do when we got it. Started doing one thing and began to do another. And recently watched a leadership video. It was a brief 20-minute leadership video. And the thing I left with was just that. If you've never dealt with it before, then it's going to be a little more difficult to address. But we are so grateful. As Susan said, I think we have a very strong and unified community. And if any good comes out of this, one of the goods will be that we will be even more unified. So Chris is now up, and then he will have the last word. Welcome, Chris.
Thank you, Lacey. Thank you, Jessica. And thank you, Susan. Can you hear me okay? Super. Well, let me just add my thanks to our healthcare heroes and healthcare leaders. This series is very important, and I'm very appreciative of the collaboration and the partnership that economic development has with our community foundation and the chamber. The roles that we play are important and impactful to the community, and we certainly recognize the value of what you all are doing every day to help keep our community safe, help provide unbelievable quality care to the point where the North Shore in St. Tammany is becoming a healthcare destination. And I want to say also, on behalf of the St. Tammany Corporation Board and Economic Development, thank you for investing in St. Tammany Parish. You represent an industry that employs over 13,000 people. You contribute to over $1 billion to our St. Tammany economy. And I want you to know that we recognize that and we appreciate your partnership. And on behalf of the parish president and the work we're doing with our resiliency committee, many of you all of our healthcare leaders serving on that committee, and I want to say thank you for continuing to educate us. And Dr. Buzzkill, we always appreciate your reality that you bring to us and keeping us on track with what we're trying to do. So you keep on doing that. We appreciate it. So again, thank you for your time. Let me emphasize what Lacey had said. If you want one of the placards or the stickers, let us know. We've got some folks inside our teams that would be happy to come and bring some to you. If you get stuck or you would like to have some in your businesses, if you're listening, please give us a shout at St. Tammany Corporation. We'll be happy to bring some to you. Lacey, thanks for your leadership on this.
Alrighty, thank you, Chris. And to our panelists, we will be sending you all the video. Thank you again. Next week's session will be on education and workforce. It will be at 3 p.m. on Wednesday. Just like today, this will be ongoing through the first Wednesday in September. So we hope that many of you will tune in to our future sessions. Thank you and have a good evening.